Hello, my name is Mandy Hall, and I'm here today to do my physical assessment. I'm going to introduce myself to my patient, tell him who I am and what my purpose is, which is a nurse practitioner student. I have washed my hands and put gel, and I have explained the entire assessment process to the patient. We're going to assume that he has on no clothes from the on the top, but he does have on a t-shirt just for filming purposes. He is healthy, well groomed. He is approximately 6'1" and 165 pounds. His vital signs are stable, 128/80. That's bilaterally matching in both arms. Pulse is 88, respirations is 18, O2 sats 99% on room air, and temperature is 98.1. Whenever he walked in, I noticed that he had good posture, good gait. His speech was even, no problems. I'm looking over his body, over his chest area. He doesn't have any scars, no tattoos. There's no visible lesions. Don't see anything that's of any concern. He does have some calluses on his hands. He states that that is from work, and that's just a normal finding for the work that he does outside. Taking a look at his capillary refill. His capillary refill is less than 3 seconds, and this will be bilateral on both hands. I'm going to start by taking a look at his nails. The nail beds are intact. There's just a little bit of nail over the end. There's no clubbing noted, and there's no problems noted with the coloring of his hands or nails. Going to take a look at his hair. When you look at hair, you want to look for distribution, the amount, whether it's coarse, whether it's fine, if there's anything that may be abnormal that would relate to another body system issue. There's no lice noted. There's no lesions noted on the scalp or on the head at this time. Looking at his face, the face is completely symmetric on both sides. There doesn't seem to be any kind of lesions or problems with the face. The hair distribution for his eyebrows and his eyes, for his eyelashes, are completely normal. He does have facial hair, and it is the same as the hair on his head. Whenever I take a look, I want to look at his eyes, at the sclera and the conjunctiva. The conjunctiva are clear. The lacrimal ducts bilaterally seem to be intact with no problems. I'm going to take a look at his maxillary sinuses. I'm going to palpate to see if there's any pain or tenderness. He's not complaining of any. I'm also going to palpate here, and no tenderness noted in those sinus areas. I'm going to take a look at his pupillary light reflex. Just look straight ahead for me. And I noticed both direct and consensual reflex in both of his eyes. I'm also going to take a look and assess his nares, and the external part of his nose looks completely normal. Turbinates are clear. No redness, no drainage, anything noted. I'm also going to test cranial nerve 1 at this time, which is the olfactory sense. I want you to close your eyes, please. What do you smell?
Alcohol.
And I'm going to check that bilaterally to make sure that that cranial nerve is intact. At this time, if I had a visual acuity, I would also test his visual acuity by holding the sign up in front of him, having him test each eye individually, and then test both eyes at one time, and assign him a visual acuity score based on what it is that he scores on the visual acuity test. I'm also going to take a look at what his fields of gaze are. This is going to check cranial nerves 3, 4, and 6. It makes sure that the oculomotor nerves are intact. I'm going to ask you to watch my finger. His eyes are following and tracking completely. No deviations. And the confrontation test is completely normal. Now I'm going to take a look and see what his fields of gaze are from the outside. I want you to tell me when I hold up my fingers how many fingers I'm holding up, okay?
1, 2, 2, 3. 2.
Okay. That is going to check and see if his peripheral vision is, of course, intact. I also want to check his eyes for the optic disc to make sure that it's intact, to make sure that the vessels are intact, and to make sure that there is a red light reflex for his eye exam. So I'm going to turn it on, and I would do this bilaterally on both sides, my eye matching his eye, but for this purpose I'm only going to do one eye. So I'm going to have him look straight ahead, and I'm going to place the light in his eye, and I'm going to move directly in, and notice the red light reflex, and then I can see the optic disc is to the left side, and all of the optic vessels seem to be intact. And again, I would do that bilaterally on both eyes and check that. At this time, I need to check his ears. So the first thing that I would do is the whisper test. So I'm going to step behind. Tell me what I'm saying.
3.
Hello.
Hello.
Okay. Whisper test is positive. No problems with that. I'm also going to do the Weber and the Rhine test. This will also test cranial nerves 8. The Weber test is going to be the top of his head. The Rhine test will be at the side. And I would, of course, conduct the Rhine test on both sides of his ears, but for purpose of this examination, I'm only going to do the one. So I want for you to tell me whenever you stop feeling the vibration. And what we're testing for is if you feel it bilaterally on both sides equally, okay? Tell me when it stops.
Now.
Okay. Tell me when it stops.
Now.
And tell me when it stops.
Now.
Okay. That completes both the Weber and Rhine test, and again, that test cranial nerve 8. I'm also going to take a look at the rest of his ears. I'm going to look for the auricle, the pinna, going to check bilaterally that there's no drainage, no redness, that there's no problems with the external canal. At this time, I'm going to grab the otoscope, and I got to get another thing, so I dropped mine on the floor. And I'm going to look at the internal ear. I'm going to check to see if there's a light reflex, if there's any air bubbles, if I notice any redness around the ear canal. And in order to do this for an adult, I'm going to pull up and out on the pinna to be able to visualize the inside of the ear. And again, I would do this bilaterally if I were doing a real examination on a patient. I'm going to take a look at your ear. And I can see the inside of the ear. I can see the reflex. There's no redness. There's no bubbles. There's no opaqueness to the inside of the ear, so I would consider that a normal exam. I'm now going to take a look at the mouth. I'm going to be looking at the lips, the teeth, the bucca, the mucosa. I'm going to check the gag reflex. When he says ah, that's going to check cranial nerves 9 and 10. I'm also going to check cranial nerve 12 whenever I ask him to stick his tongue out and move it around. That'll be checking that cranial nerve. I'm also going to be looking under the tongue. And then at the end, I'm going to ask him to clench his teeth, which is going to check cranial nerve 5. So I need for you to open your mouth for me. Everything appears normal. Uvula is midline. I can see the back of his throat. Say ah.
Ah.
Cranial nerve intact. Move your tongue around for me. Lift your tongue and let me see the underside. Everything is normal. I don't notice any abnormalities at all. I need for you to look at me and clench your teeth together. Okay. Any problems with that? Any pain? Okay. So then I'm going to take a look at his neck. I want to check cranial nerve 11, which is the trapezius strength. So I'm going to have you lift your shoulders to my hands. Don't let me push down. Okay, very good. I'm also going to check his carotid pulse. I'm going to check for any bruits. Carotid pulse are intact bilaterally. And then also I would check for bruits bilaterally. I don't notice any, and while I'm at this point, I'm also going to check his temporal for any irregularities. I'm going to listen to it. And again, I would do that on both sides. I'm going to take a look now at his trachea and thyroid. Just going to palpate. I want you to swallow for me. Okay? Everything looks completely normal. I can't get behind the stretcher because the stretcher is against the wall, but if I were going to appropriately assess his thyroid, I would be completely behind him and assess on either side for any swelling, goiter, any pain, tenderness, or problems with his thyroid. And I'm noting that to be normal. I'm also going to take a look at what his range of motion is. So I want you to extend your neck back, put your chin to your chest, put your chin side to side to your shoulders, and also put your ear to each one of your shoulders. Okay. No problems with mobility there, no issues at all. And that checks all of his musculature and any issues with his neck. Also going to take a look now at his lymph nodes. So I'm going to take a look at the pre-auricular, the post-auricular, the tonsillar, the submental, the submandibular, the superficial, posterior, and deep cervical nodes. And I would palpate a little bit more down for those to make sure that there's no swelling. I also want to make sure that there's no fixed nodules. Fixed nodules are bad, and swelling can indicate, and pain can indicate infection, obviously. So now I'm going to take a look at his chest. Remember, his chest is completely exposed. I'm going to take a look, make sure that everything is symmetrical, that the hair distribution is normal, there's no lesions, there's no moles, there's no scars. Take a look from the side, and his AP is 2-to-1, anterior and posterior is 2-to-1. I also want to take a look and touch and make sure that everything feels normal upon inspection, and everything does. Now I'm actually going to listen to heart sounds. I'm going to go in a left-right motion across the back, and then I'll do the same across the front. Deep breath for me. Okay. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. I also want to take a look and listen to all of the lobes in the front. So deep breath. Deep breath. Deep breath. Stop. Deep breath. Apparently I've turned over his tickle box. I'm also going to take a look at his heart sounds at this time and make sure that they're all normal. I'm looking for S1, S2 in each one of the sounds, which is a lub dub. I'm going to make sure that there's no murmurs, no ectopy, and no extra sounds within the heart if he will stop laughing, so that I can take care of his heart sounds. Okay, sir, I'm going to listen to your heart sounds. I'm going to listen first to the apical. Don't just breathe normally. I'm then going to listen to the pulmonic valve. Then I'll go down to Erb's point, the tricuspid valve, and the mitral valve. All of the heart signs are normal. There's no murmur. Everything has S1, S2, lub dub, no extra sounds. I'm also now going to take a look at the breast exam. You want to make sure and do a male breast exam just the same as you do a female breast exam. I'm going to do it now, and then I'm also going to take a look whenever he lies down to make sure that it's equal and symmetrical on both sides. I'm also going to ensure that he's doing self-breast exams at home to make sure that he's palpating for any lumps, nodules, bumps, anything like that. So you'll start at the nipple, see if there's any sort of drainage, see if there's any puckering, any changes in the skin tissue around. And you're going to go in a circular motion around the breast in circles, and feel all the way around to make sure that there's no lesions and no nodules. Then you want to lift the arm up and move up the tail of Spence all the way up until the axillary nose to feel if there's any differences up under there. And everything looks good. So at this point, I'm going to have him lie on his back so that I can start the abdominal exam. So I'm going to take a look first. With the abdomen, you want to inspect first. Make sure that there's no heaves. I can take a look right now and see the point of maximum impulse of the apical pulse. I want to make sure that there's no lesions, no scars, that everything is completely within normal limits visually. After that, I'm going to auscultate, and I'm going to listen to all quadrants and make sure that bowel sounds are present in all quadrants and normal. And they are normal. So now I'm going to percuss. Specifically, I want to look for a fluid wave across the abdomen to see if there's any kind of liver ailment, any ascites. I also want to auscultate over the liver to see if there's a dullness over where the liver should be, and that's on the right side under the rib cage, and then also on the spleen on the left side. So I'm going to percuss at this time. Start at mid-clavicular line and move down and move around, listening for the change from hyperresonance in the lungs down to the dull resonance whenever you palpate the liver, which is a solid mass. I'm going to do the same thing on the left side and listen for the resonance of the spleen in the same area on the left side of the chest. At that point, I want to palpate. I want to feel the abdomen to see if there's any visible or palpable issues, if there's any pain, if there's any tenderness, and also I want to feel and see if I can feel the liver and the spleen. Feeling the liver would indicate enlargement, which may lead me to do other testing. So I'm going to palpate gently at first in all quadrants, and then once that's complete, I'm going to palpate deeply in all quadrants. Is there any pain or tenderness? Okay, in order to palpate the liver, I'm going to do the hook method, which if I were able to get to that side of the bed, I would take the rib cage and palpate just under the rib cage and pull up to see if I'm able to feel the lobe of the liver, and I'm not able to do that. On this side, I'm going to palpate from the spleen. I'm going to press on both sides just under and see that if I can palpate the spleen that way. And check and make sure that there's no swelling, anything like that. At this point, I'm going to have him to sit back up. And I'm going to take a look at the musculature and the joints now. So at first, we're going to take a look at the shoulder. I'm going to note the clavicular joints. I'm going to note the humerus. I'm going to note the elbows. I want to make sure that he's able to lift his arms up above his head. And then I want you to take your arms and move them back this way. And then after that, I want you to put your hands behind your head and then move your hands around and grasp them behind your back at the small of your back. Okay, you can relax. This tests all of the arms, shoulder muscles, the joints, and make sure that everything is okay with that. Then I want to take a look at the elbows because that's obviously the other end of the arm. I want you to flex it for me and then extend it out. And I want you to take your hands and rotate them back and forth. Any pain with that? Okay. That should be good for the elbows. I'm going to take a look at fingers. I want you to open them up, close them, make a fist with your thumb on the outside of your fingers. Okay. I want you to open your hand and try to close your fingers around me pressing. Very good. I want you to grip my hand with your best grip. Very good. I want you to take your wrists and do them this way. And again, I'll be doing this assessment on both sides of the body for every one of these assessments I'm doing. And then take your wrist up and down. And that tests all the range of motion of the wrist. I'm going to hold your hands and I need you to pull against me. Okay? And now I need you to put your arms up and I'm going to push Don't let me push. Very good. Okay. I'm also going to check the brachial and the radial pulse at this time. And again, I would be doing this bilaterally. Pulses are all 2+. All of them that I've checked so far are 2+, so there's no problem with that. I'm also now going to check the feet and ankles. I want you to flex your feet up and down and back and forth. Okay, I'm going to rate my on the bottom, and I noted the Babinski reflex, and that is a negative reflex. I'm also going to take a look at whether he's able to twist his ankles back and forth. If you'll do that for me. Very good. Okay, now I'm going to let you lay back down, and we're going to take a look at your knees and your hips. So what I want you to do at first is raise your legs straight up off the bed, and don't let me push down. Very good. Okay, now I want you to bend your knee up to your chest. Very good. I do know that he has a scar on the left side of his knee, and that's from a football injury that he had in college. Also going to take a look at internal and external rotation. I want you to move your hips back and forth without moving your trunk. There you go. Very good. I'm also going to check the stability of the pelvis and of the hips, and he doesn't note any pain whenever I feel and take a look at that. And take your feet and push against mine, and don't let me pull your feet down. Very good. Wiggle your toes for me. Very good. Okay, I need for you to, okay, I'm going to do the posterior tibial pulse, which will be 2+. I mean the knee, the pulse. And then I'm going to do the posterior tibial pulse, and I'm also going to do the pedal pulse. And note that all of them are 2+. There's good capillary refill and no issues. I'm also going to palpate his inguinal nodes at this time. Make sure that there's no swelling in his inguinal nodes. And I'm also going to note that his femoral pulse is 2+, and that there's no issues there. I now need to take a look at the genital area. What I would do is inspect and see if there was any lesions, any swelling, that the foreskin is in place, that both of the testicles are symmetrical, that there's no hernia. I would palpate under the inside of the testicles and have him cough to make sure that there's no hernia present, and then also palpate in the inguinal areas to make sure that there's no hernia there. So right now I want to tell you to remember something for me and repeat after me. Red car.
Red car.
Blue boat.
Blue boat.
Yellow banana.
Yellow banana.
Okay. Before we stand up, I want you to take your heel and put it to your knee and move it down your leg. And this is testing the cerebellum. And I would do that bilaterally as well. So now I'm going to have you sit up for me again. And I'm also going to check the cerebellum. I want you to take your hands and flip-flop them across your legs like this. I want you to take your fingers and touch each one of your fingers to your thumb. And he has no problem doing that. I want to test sensory. I want you to close your eyes for me. And I want you to tell me if you feel sharp or dull, and I want you to point to the place that I touch. Sharp or dull?
Dull.
Okay.
Dull. Sharp. Sharp. Dull.
You can tell me where it is.
Foot.
Okay. All right.
Right foot. Dull.
Okay. And
Sharp. Cheek.
okay.
Sharp.
Okay. And then I'm also going to put something in your hand, and I want you to tell me what it is. Close your eyes and hold your hand out. And what is that in your hand? Okay. I'm also going to have you to stand up right now. And I'm going to inspect your neck and your spine if you'll turn around for me. Going to take a look and feel down the spinous processes and make sure that there's no pain, no bulges, no processes, nothing out of the way. I need you to bend down and try to touch your toes if you can, as far as you can. Very good. Okay, and now I need you to squat if you can and stand back up. This is testing all the muscles and reflexes again, or joints. And I'm also going to check now, since I have him turned around, to see that he has equal lung expansion, and also check and see if there's any tactile fremitus. Okay, I'm going to have you breathe for me, and then out, and then one more time, out. And what I'm doing is watching my thumbs to see if there's equal expansion and that both sides of the chest are expanding equally, and that is happening. Now I'm going to check tactile fremitus by asking him to repeat after me. So 99,
99,
99,
99,
99,
99,
99.
99.
Okay. Tactile fremitus test is completely normal. I need for you to turn around again, and you can have a seat. And if you'll repeat to me those three objects that I told you a minute ago.
Red car, yellow banana, blue boat.
Okay. That's testing the memory and his ability to remember things, obviously. Next, I'm going to take a look at his reflexes. So I'm going to first check the brachial. And that was positive. And then I'm going to take a look at the, excuse me, okay, positive. I'm going to take a look at the wrist. We're going to hit here. Positive. And then we're going to take a look at the patellar reflex. And that's positive. Again, I would be testing all of these reflexes bilaterally and checking to make sure that they were equal and they're 2+ on each side, which they obviously are. And then that is it. I'm done with the exam. I've tested the cranial nerves. I've tested his muscle system, his joint system, respiratory system, cardiac system, neck, thyroid, face. Oh, one more thing. I need for you to smile for me. Stick your tongue out and move it around. Puff your cheeks up. That also tests, you can let your cheeks go, the cranial nerves as well. Do you have any questions?
Ma'am.
Okay. And that is the end of my exam. Mandy Hall.